In this video, we'll discuss Model Paper 2 for competitive examinations. And this is part 1. We've already discussed Model Paper 1. The first question is, bioavailability refers to the relative amount of drug that reaches the small intestine, duodenum, systemic circulation, or liver. And the answer here is systemic circulation. Second question. Cyclosporin is indicated in the transplantation of heart, kidney, liver, or all of the above. Cyclosporin is an immunosuppressant which is indicated for the transplantation of all of the above. The recommended daily dose of vitamin B12 is 0.1 mg, 0.01 mg, 0.001 mg, or 1 mg. The correct answer here is C, 0.01 mg. Antidote for iron poisoning is flumazenil, pralidoxim, deferoxamine, or atropine. Answer is C, deferoxamine, used to remove excess iron from the body and to treat acute iron poisoning. Clofazimine is classified as anti-epileptic, anti-neoplastic, leprostatic, or analgesic. It is leprostatic, used to treat a form of leprosy called lepromatous leprosy. Moving on to the sixth question. A normal therapeutic range of prothrombin time is 6 to 9 seconds, 9 to 12 seconds, 12 to 15 seconds, or 15 to 18 seconds. 12 to 15 seconds is the normal therapeutic range of prothrombin time. In which of the following technique the sample is kept below triple point? Lyophilization, spray drying, spray concealing, or centrifugation? The answer is lyophilization or freeze drying. It's a low temperature dehydration process that involves freezing the product. Wilson's disease occurs due to a disturbance in magnesium metabolism, copper metabolism, zinc metabolism, or selenium metabolism. Wilson's disease is an inherited disorder that causes too much copper to accumulate in the organs. So the answer is B, copper metabolism. All are penicillinase-resistant penicillins except methicillin, cloxacillin, napsylin, penicillin V. The correct answer is option D, penicillin V, also known as phenoxymethyl penicillin. It is not active against the penicillinase-producing bacteria. The first World AIDS Day was observed in which year? 1978, 1988, 1998, or 2000? First one was in 1998, December 1. Hypersecretion of thyroid hormone results in myxedema, goiter, cretinism, or Graves' disease? The answer is D, Graves' disease. Imuran is brand name for cyclosporin, tacrolimus, sirolimus, or azathioprine. Answer is D, azathioprine, which is an immunosuppressive medication. Beta blocker used to treat migraine: pindolol, acebutol, timolol, propranolol. Answer is propranolol, which is used to treat heart problems, help with anxiety, and prevent migraines. Okay, now moving on to the 14th question. Extracellular fluid contains high concentration cation, potassium, magnesium, sodium, or phosphate? The right answer is C, sodium. Antidote for methanol is ethanol, butanol, disulfiram, or flumazenil. A 10% ethanol solution administered intravenously is a safe and effective antidote for severe methanol poisoning. Sulfonamide category drug used to treat eye infections: sulfadiazine, sulfadimidine, sulfacetamide, sulfafurazole. Sulfacetamide, option C, is used as eye drops to treat eye infections. Lasix and Kinex are the trade names of polythiazide, ethacrynic acid, furosemide, bumetanide. So the right answer is C, furosemide. Red or green color blindness is reported with INH, pyrazinamide, streptomycin, or ethambutol. The answer is ethambutol. Its main adverse effect is optic neuropathy, which can cause red-green blindness, decreased visual acuity or central scotoma, and it can be reversed with the discontinuation of drug. Moving on to the next question. Methylation of which of the following compounds results in the formation of codeine? Methylmorphin, codeine, oxycodone, morphine. The answer is option D, morphine. The methylation of morphine results in the formation of codeine. Now let's see the 20th question. How many grams of zinc oxide required to prepare 750 grams of a 20% zinc oxide ointment? 100 grams, 150 grams, 130 grams, or 170 grams? The answer is B, 150 grams. Next question. Tagamet is a brand name of famotidine, ranitidine, cimetidine, or nizatidine. The answer is C, cimetidine. Large doses of paracetamol are likely to cause renal tubular necrosis, tinnitus, seizures, or hepatic necrosis. Answer is D, hepatic necrosis. Paracetamol metabolite NAPQI decreases liver's glutathione and directly damages liver cells, which leads to hepatic necrosis. Okay, so this NAPQI is N-acetyl-P-benzoquinone, a metabolite of paracetamol. This metabolite is actually causing the toxicity rather than the paracetamol itself. Alzheimer's disease is treated with gabapentin, sertraline, tacrin, or amitriptyline. The answer here is option C, tacrin. 24th question. Amino acids are joined by dash in proteins, and the options are double bonds, hydrogen bonds, peptide bonds, or none. So the answer is pretty much easy, right? Peptide bonds. Scabies is a contagious skin disease caused by fungus, flea, mite, or tick. Scabies is a contagious, intensely itchy skin condition caused by tiny burrowing mite. 26th question. Machinery purchased on credit will be recorded by sales book, journal proper, cash book, or purchase book. And the answer for this is option B, journal proper. It's a book maintained to record transactions. Moving on, the balance sheet does not contain real account, personal account, normal account, or none. This one, the answer is normal account. The major protein of connective tissue is collagen, keratin, myosin, or globulin. And that major protein is collagen. It provides structural support to tissues and plays important role in cellular processes. Okay, so now let's see the next question, 29th. The major plasma protein involved in drug binding is globulin, albumin, glycoprotein, or creatinine. And the major plasma protein is albumin, option B. An albumin blood test checks your liver and kidney function. Now the 30th question, which of the following systems is used in the Indian pharmacopoeia? The options are metric system, apothecary system, avoirdupois system, or none. Which one is used in Indian pharmacopoeia? The answer for this is A, metric system. Let's see the next question. The grade of a very fine powder is 22, 120, 85, or 44. The grade of very fine powder is 120. Mannitol is used therapeutically primarily as anti-anginal agent, plasma substitute, cardiac stimulant, or osmotic diuretic. Mannitol is an osmotic diuretic. It forces urine production in people with acute renal failure. 33rd question. Antidote for malathion poisoning is protamine sulfate, pralidoxim, vitamin K, or nalorphine. The antidote is pralidoxim. Polycythemia vera refers to an elevated number of the options are thrombocytes, leukocytes, granulocytes, or erythrocytes. So, polycythemia vera is a type of blood cancer in which the bone marrow makes too many red blood cells or erythrocytes. This thickens the blood, which in turn can lead to blood clots and serious complications. It is a rare type of disorder. Now, moving on to the 35th question. The compound which undergoes biotransformation before showing desired pharmacological activity is called prodrugs, implants, liposomes, or nanoparticles. The answer is prodrugs. Acute atropine poisoning is treated with pilocarpine, physostigmine, pyridostigmine, or none of these. Acute atropine poisoning is treated with physostigmine. Thyroid cancer is diagnosed with the options are sodium hippurate, sodium phosphate, sodium iodide, or sodium sulfate? The answer is option C, sodium iodide. Tropane alkaloid is caffeine, papaverine, quinine, or atropine. The answer is option D, atropine. 39th, test specified to identify the carbohydrates. Murexide test, Mulisch test, Vitalis test, legal test. The answer is option B, Mulisch test. Is used to identify carbohydrates. Life period of drugs is dealt in which schedule? Q, R, P, or S? The answer for this is Schedule P. The Central Drugs Laboratory is established at. The options are Lucknow, Izzatnagar, Kasauli, or Calcutta. The right answer is Calcutta, option D. 42nd question. Which of the following insulin exerts the longest duration of action? Lente, protamine zinc insulin, NPH, semi-lente. The answer is option B, protamine zinc insulin has the longest duration of action. 43rd question. A drug most useful to treat chronic severe pain is. The options are fentanyl, codeine, propoxyphene, acetaminophen. The answer is fentanyl, A, option A. This is synthetic potent opioid medication used to treat chronic severe pain. Moving on, sulfonamide drug best suited for topical treatment of burns is sulfasalazine, silver sulfadiazine, sulfacetamide, or sulfamethoxazole. The answer is silver sulfadiazine, used to prevent and treat wound infections in patients with second and third degree burns. Example of polyvalent vaccine: BCG, diphtheria, oral polio, or all of the above. The answer is oral polio, option C. A polyvalent vaccine is used to immunize against two or more strains of same microorganism. The lifespan of RBC is, the options are 30 days, 60 days, 90 days, or 120 days. The lifespan of an RBC is usually 120 days. Which of the following drugs is classified as calcium channel blocker? Amlodipine, clonidine, losartan, acebutol. Amlodipine is a calcium channel blocker. 48th question. The principal constituent of shark liver oil is vitamin C, vitamin A, vitamin K, or vitamin B1. The answer is option B, vitamin A. Capsules are manufactured with pectin, arabin, gelatin, or starch. Capsules are manufactured with gelatin. 50th question. The lack of formation of bone marrow results in sickle cell anemia, aplastic anemia, macrocytic anemia, or microcytic anemia. The correct answer is option B, aplastic anemia. So the part 2 of this video will be made soon with the rest of the questions. So make sure you subscribe to this channel and turn on the notification bell to not miss any videos. Stay tuned for more.